Welcome back to this series in collaboration with Monash University. So we're all Monash Uni students and we'll introduce ourselves in just a sec. But just as a reminder, this is a part of the collaboration between MARC, or Monash Aquatic Centre, Recreation Centre, and Monash Uni. And we're talking about mental health. So how we think, how we feel, how we behave, and especially in the context of COVID. Because I don't know about you guys here in this conversation today, but it definitely has thrown some curveballs, and I think a lot of people are experiencing it in unique ways and also in ways that we probably can all relate to. So just to quickly introduce ourselves, I'm Rochelle. We have Rebecca, Bec and Shareena with us as well, and they'll introduce themselves as we go. And the topic that we want to talk about today is how do you support someone who is experiencing a mental health condition? So without further ado, I think we'll get right into it. Rebecca, what do you have for us?
Well, so what I wanted to do is I just wanted to talk about mental health conditions more broadly. So a lot of people, they hear the term mental health condition, they might hear mental illness, they might hear things like that thrown around. And basically, it's a general term, and what it refers to is it's a group of sort of conditions that you can have, but the main line is that it affects the way you function. So it's a state of mind that you might get into that affects maybe how you sleep, it can affect how you eat, it can affect your behavior at work, and this can be in a variety of different ways. So you guys would have heard terms like depression before, or anxiety, obsessive compulsive disorder. There's a whole range of different ways that mental health conditions can affect you. And I think more specifically with what's been going on during this time, during COVID-19, anxiety is a mental health condition that has popped up for a lot of people. So that's what mental health conditions are.
That's really interesting, Rebecca. I can't imagine how scary it is to be experiencing all that alone. So it's important for us to recognize any signs or behaviors early so that we can provide them with the support that they need. So, someone with a mental health condition may have a diagnosis or just a few symptoms of the condition, such as, suicidal thoughts or non-suicidal self-injury and panic attacks. So in particular, panic attacks are really common, with 1 out of 4 people in the general public experiencing it at some point in their lives. And a panic attack is basically an episode of high anxiety, fear, and discomfort that suddenly happens and peaks within 10 minutes. So physical signs can be, like a racing heart, having trouble breathing, and just feeling really tense and edgy. And psychological signs can be having an irrational fear of dying or losing control because of the physical signs. And the person may also avoid anything that may make them feel more anxious. And the symptoms of a panic sometimes resemble symptoms of a heart attack or another medical condition. It's not possible to be fully certain, so only a medical professional can tell if it's something more serious. So therefore, it's important for us to first ask them if they know what is happening or whether they have ever experienced a panic attack before. And if they have, ask if they need any help. If they have never had panic attacks before, it's best to just follow physical first aid guidelines and seek medical attention immediately.
That's a really good point about referring to someone with kind of special training in a certain area, like you mentioned, asking a doctor for extra help, because one of the conditions or symptoms, that you mentioned was having an irrational fear of dying. And something like that, I think for a lot of people is probably hard to gauge during COVID-19. This is something that we haven't experienced before, and it's hard to tell what's rational and irrational sometimes. So it could be helpful to kind of take conservative measures and to appreciate that extra help may be needed. And that it's okay to ask for help, even if it turns out you didn't need that kind of help.
Exactly. It's good to always just reach out for the professional support that is around you, especially in a pandemic period like this.
Yeah, that's really helpful. Bec, what did you want to add to the conversation that we've had so far?
I guess what I wanted to add is just a couple of ways that we can help family and friends when they are sort of experiencing anxiety in this time, which I know, as we've talked about, is really common at the moment. The first way that I had was actually learning about mental health conditions, so anxiety and recovery, as we've just talked about, sort of identifying what these are and even talking to the person about how they experience this. And then I guess the next thing to do is how we can actually help them. So because we are all different, not everyone will find the same thing helpful. So what's really important is about asking that person what actually might help them. Because I know a lot of people out there like a lot of support, sort of someone almost cheerleading for them to boost their confidence, whereas some people might sort of want you to be more of a bystander, sort of maybe silent support. So it's really important to ask the person what is best for them.
Yeah, that's really helpful. Thanks, Bec. Because that kind of reminds us that what we're talking about here with supporting someone with a mental health condition, there are broad applications and ideas that are relevant. And then there are also specific things that some people might relate to, but could be really unique to your own experience, to the people in your lives that you care about and that you're looking out for. Because I guess right now we're all just looking out for each other and trying to do the best that we can.
Yeah, absolutely.
So I guess we wanted to keep it kind of short and sweet today and leave people with a few important things to think about. So that's kind of what we had for everyone. And we're really grateful for the questions that have been coming in on the Mark website. And just a reminder that there are other videos that have already been uploaded onto the website as well. So there are some ones, you've met us before when we were talking about motivation, and some of our colleagues were talking about stress, for example. So there are a few others up there that we hope will still be a useful resource to anyone that might be watching. So thanks, guys, for having this chat tonight. Take care of yourselves, and we'll touch base soon.